Mark, thank you very much. Eyewitness News is your vaccine authority, and we are getting more and more questions every day from all of you at home. We certainly appreciate it. We're doing our best to try and get answers for you. A lot of them are actually the same. You're all thinking the same thing these days. Joining us live is Dr. Henry Anyimadu of Infectious Diseases with the Hospital of Central Connecticut. Doctor, thank you again for joining us today. We appreciate it. Good to see you.
Happy to be here, Mark.
Well, as I said, we keep getting a lot of these questions, and many of them really are the same because I think people have the same concerns and the same thoughts right now. So I want to start with Susan from Higganum. She wrote us and said, after my first Moderna shot, I had a headache and chills and eventually even threw up. She said, this is actually good, right? Does it provide any indication of what I should expect when I get that second shot?
Well, all of these side effects or adverse effects are expected. It just means that your immunity is boosting up. It just means that your immune system is ramping up and your body is responding appropriately. So injection sites, pain, fatigue, fever, chills, body aches, all of those are expected. And in general, most people had more reactions in the clinical trials with a second vaccine dose than the first one. Having all of these reactions with the first dose does not necessarily mean that you're going to have it with a second dose. But in general, most people had the reactions with a second dose.
I was going to say, we actually hear that a lot from people. I know some family members and friends, even folks here at work, after they got the second shot, they had more of a response. You see that as well?
We do see that. And as I said, once you get the initial dose, which is the primer dose, the booster dose sort of ramps up your immune system. So it just means that your immune system is working, and it's expected.
All right, that's good. So don't panic. That's the advice from the doctor right there.
That's right.
Now, another question here from a viewer. What happens if I get COVID after the first shot and before I get the second one?
Mark, it just depends on how far away you are from the first shot, right? If you are more than 2 weeks away, immunity. And the good news is from COVID-19, we wouldn't expect you to have severe infection with COVID-19 or even get hospitalized with COVID-19. So it just depends on how far away you are from the first dose. But most likely, if you're more than 2 weeks away, you should have some significant immunity.
Doctor, before I let you go, I just want to ask, are you pleased with the direction we're heading right now?
Oh, I'm excited. The people are accepting the vaccines and making the appointments to get the vaccines. And I will encourage everyone to keep making sure that they get vaccinated and then continue with all the public health measures whilst everyone gets vaccinated.
Absolutely. Dr. Henry Anyimadu, thank you again very much for joining us. We always appreciate when you join us and you have such good answers, calming answers, and we all need to be calm right now. So thank you again, Doctor.
You're very welcome, Mark.
Have a good weekend. We'll see you soon. Now, if you need help at home with an appointment, you can always call the United Way's Vaccine Appointment Assist line. The number right here, 877-918-2224. It's staffed every day. If you leave a message, they are working right now to call people back as quickly as they can. But keep in mind, they get a lot of phone calls right now. We'll be right back.